What's up, guys? It's your big boy Miguel giving you your daily dose of radiation. In today's video, we're covering the difference between Xray versus nursing school. So to give you some credentials, I am an Xray tech, graveyard shift, been in the game for about 4 years. And my lady, a wife now, is a nurse. And a while back when we first started dating, because she was like graduating and I was about to enter the program, we talked about, the differences amongst our things, because, I was curious to know, because a part of me was like, maybe I will be a nurse. No, hands-on would not make it through their program. Barely made it through my program. I will say just like tenfold. Nursing program is very, very hard compared. Xray Tech, they have their niche hardness, but as a general whole, it is quite difficult to go through the nursing program. I will give them that. We've compared many, like between classes and between overall stress load. Like they have it like a times like 2 or 3 multiplier, and it just boggles my mind. Which part of me like kind of understands, because like once you're actually in the job, like your responsibility level like jumps up. Like it's a lot. Like I see them how more stressed they are compared to us. They do make slightly more money than us in certain fields, like depending on the level of nurse you are, because like RN versus BSRN, whatever. But anyways, this is for the education side. They have certain classes that are notorious for being hard. Like I think it was like pharmacology. Like we compared our pharmacology class, which ours wasn't even a class. Ours was like a little segment, like a little chapter over pharmacology, versus like their whole thing is like the whole class is pharmacology, because they got to know all the drugs. And I was like, I sat down one day, I'm like, how do you know all these like drugs? Because like there's so many, and like some of them it's like a word or two that makes like the whole difference. And they can, like, if you get it wrong, you can kill your patient. And it's wild. She gave me like all her little spiel of what she does to get everything correct, and I'm like, that's like mind-boggling. Because ours, we barely that. Like for Xray, we barely use any medication to begin with. It's like lidocaine, gastrografin, and like just like barium, like basic stuff. It ain't nothing like crazy. But anyways, they had that, and then there was that class, and then there's something like their nursing skills program, which is ours, kind of like our lab thing. Like theirs, she would tell me how they would have to like simulate it on a computer and it'd be like hard, versus ours, we would just kind of like, you just have to remember the positioning and kind of have to do it in front of your instructor type deal. And even they had to take, I forgot what class it was. There was like a class you have to take. No, they had to take microbiology, and we didn't have to take that one. That one right there, that one's a little bit more difficult. We as Xray techs, we didn't have to take microbiology, and they had to take like nutrition, and they had to take, like they have like I think a few more prereqs than we do. I mean, it kind of evens out, because like we have to take physics, and we have to take like other courses that they don't have to take because of our history of what we use and stuff. And then as far as like overall class load, they have, I want to say they have a lot more like workload, because like we've compared like notes. Like some of them, they'll have to like verbatim like the medication on a patient. They'll like mock having a patient and like all their problems, and then like the nurse will be like, okay, what does this patient have? Da 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 da. What do we do? Da 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 da. And they're like, okay, first rule is da da da. Like all these meticulous steps you have to go just to get it right. Like my lady said that one time she was like crying because she didn't know how she was gonna get it. And then there's a certain class, I can't remember what class it is, but it is like really, really hard. And it takes like search, is it med search? Med search, that's what it is. I think it's called med search. That class is like notorious. Is it med search? Might be med search or path search. It's like notorious to being like, you have to be a certain kind of nurse to like that because it is like hard, like very hard. And I'm like, well, we just had like physics and like we had, what was it called? Pathology and like advanced positioning. We had certain stuff that are like what's called like the peak hard classes of the program that are notorious for taking a bunch of students out. But like theirs is like it is more harder, and they have to do through even their board. Well, I forgot what it's called. I can't remember at the top of my head what they have to take. It's called something where it's like, I asked her, I'm like, what do you need to pass? She's like, well, you go to the place and then you sit there. The computer pops up and then you're just like, you're doing your stuff. It's like they say, if the questions get harder and harder, usually you're doing good, because you're getting them right and they're, stepping up their difficulties. He's like, there's not really a set amount, but just like you'll be doing it and then it'll turn off. And then you'll know if you pass. And I was like, what? Because like ours, it's like, okay, you have like, I think it was like 210 questions, I think it is, and like 10 of them don't count, or is it 200 questions and 10 of them don't count? And then you just like, when you don't know it, you just like hope to God this is one of them questions that don't count, and like they're split up into certain criterias and all that stuff. Like every year or every once in a while they'll like kind of change like which ones are heavy, like are worth more depending on whatever it is. And like you need 75 to pass, like basically. Like once the tests finish, like they'll say there, 75 or whatever. So essentially it may go up by like up a point or two or go down by like but in the general gents, you'll know if you passed or not, basically. So that's quite different. And then see what else they have. Let me pause it real quick. And then every couple semesters there's something called like leadership, which she told me like the whole shebang about how you make like some posters and like you have to like, it's a rite of passage and how you're doing something like with the other students who are coming up, and like you're kind of putting them in game. And like as a whole, there's more, like almost every big college, like there's way more colleges that offer a nurturing program compared to Xray Tech. So that alone is kind of niche. Like even where I live, there's only 2 that are close, and then 2 other ones that are like 2 hours away. And then there's the ones I will graduate, like it's only very select places that offer Xray. And then if you want to, continue your educations to like CAT scan, nuke, and all the other modalities, it gets even more range far apart or very niche locations where they offer it. So that can be a challenge for certain people. Like nuke mech, I think there's only the closest one is like in Arkansas, which is like 5-6 hours away from here. And then like MRI, I think the closest one is like all the way down to Houston, so that's like 4 hours away. So it's like kind of specific. And like even here in my city, you could become RN, BSRN, like that's like your bachelor's. They offer it here in our like university that we have here. And then mine is that you can just get an associate's degree, and then if you want to pursue your bachelor's, which I mean for X-ray you really don't need a bachelor's, you just need an associate's degree. Bachelor's is mainly like if you want to become like a teacher, or you're trying to be like the head of radiology, like not the head of like X-ray tech, but like the head of the whole shebang, like the whole radiology, like the top dog. You will probably need a bachelor's for that, because our tech who runs just our X-ray tech department, he went through the same program I did. He'd just been in the game like a little bit more longer than I have, and stuff happened and he's running the joint. So even the actual like lab work and stuff, when you go through the nursing program, theirs is pretty invasive. Like they have to stick each other, they have to do lab, they have to do various stuff, which we didn't have to do. Oh, like yeah, we'll position them, but we won't like radiate you. Even even when we went through lab and they kind of showed us like how to like stick a patient for blood work or for the IVs and stuff, we were just on a dummy. We weren't doing it on ourselves. I mean, once you got into the actual clinicals, like yeah, maybe a tech, like a certified tech would tell you, oh, try it on me, blah blah blah. That's mainly like for CAT scan, or like if you were in nuke med, they would do that. Because basic X-rays, you really don't need it at all, because we really don't do anything. I mean, even if we need to give medication, like the nurses will come and do that, we really don't have to do none of that. So in a gist, I would say that yes, X-ray tech program has certain stuff that would be challenging and difficult, but in an overall sense, for most people, the nursing program would be more challenging. I was told, or like just at my college, that we had, I want to say, a few more extra hours than the nursing program did. But then again, when I see what they be doing at clinicals versus what we be doing at clinicals, and how harder theirs is, it understands why they have to do less than we do, because ours is more slack. So there's that. And then as far as like program stuff, you'll have to kind of make sure that whichever program you're choosing to go to is accredited, board certified, because occasionally they won't be. Sometimes, yes, I know. We've had, and it's not that they aren't, it's that maybe something will happen and they're not, the state will review them or whatever, and then they'll lose their thing. And then anyone who's going through the program, when they graduate, they get kind of the short end of the stick, and it sucks. Happened to ours, not to my X-ray tech program, but I think it was like the surgical tech program, whatever, didn't pass or was up for review, and something happened and they didn't meet the requirements. So like everyone who graduated kind of got, yeah, they couldn't do anything with their degree. That kind of sucked. So make sure that whichever program you go to is accredited, because even ours, for X-ray I'm talking about, you have to make sure that you're going for the full shebang, which I mean is like the full RT, because there is limited RT, which with that one you can't do any like fluoro stuff. You can only do like, I think it's extremity work. That's all you can do. So that one's the LMRT versus me, which is the full RT, which is just the RTR. So that's something different, which same thing with nursing. You have like LVN, you have RN, and then you have the BSRN. So there's different levels of nursing, which even in ours we have CAT scan, nuke med, all the other ones too. So whichever one you choose, just do your education. Make sure that whichever one you choose, that it is state board certified and they have a good history of doing stuff. Because like your school makes a big difference on whether or not how good you are, or if you'll make it through the program, or the biggest thing, how prepared will you be to pass the actual board? Because my lady, even she's had other friends in different programs, still nursing, but like different places, and like they both have the same degree, but they'll completely different stories. Like certain ones like felt like they weren't as prepared, other ones felt they were over prepared, and like the whole shebang. And then even with mine, I've even looked into other colleges and seen how their stuff was structured and how they did stuff, and it's way different. And I mean, I felt that my Xray Tech program did pretty well. I mean, there's other places that I feel like could have been slightly more challenging. Certain places could have been more useful. So it all kind of depends. Because there is like kind of a fast track program. And then there's the kind of where I went, which was my slower pace. So it all depends on the level of how fast can you absorb stuff and pass your test type of deal. So, because like if you have the Sheldon people who are like, super smart, you might kind of get bored when you're taking certain stuff and you're like know-it-all, and then so do your due diligence and learn, do a brief education on that, just to give you a little heads up. And yeah, it's been your boy Miguel. See you on the next one.